Hello, good afternoon. This is Dr. Judy Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to my lunch time open clinic. It's my intention to spend the next 30 minutes to talk about the topic for today's discussion. So today we're going to look at prolactin as a hormone which is very important in the whole spectrum of female reproductive system. Prolactin hormone. So prolactin is a hormone that will play a big role in the process of development of the breast. And not just the development of the breast, the process of milk production. So for every woman that will be a mother, it's expected that the level of your prolactin must be within a safe range, a healthy range to enable you to develop your breast, to enable you to produce milk, which will feed your baby. This is the standard expectation. Now, if anything happens to the prolactin itself, so what do I mean by anything happening to the prolactin itself? If the level goes up or down, outside the safe range, it can be a problem. So the only time that prolactin level should be high in a woman, it's during pregnancy and when she is newly delivered of her baby. In a non-pregnant state, your prolactin level should be within normal range. So if your prolactin level is high, it's a problem that can affect your ability to become pregnant. When your prolactin level is high, there's a medical terminology called hyperprolactinemia. When your prolactin level is high, it will affect the function of other important reproductive hormones in the woman. Hormones like your estrogen, your progesterone, your FSH, your LH. Your FSH stands for follicular stimulating hormone. Your FSH is the hormone that will go and prime the ovaries so they will release the egg. Your LH is the hormone that signals the body that the egg has been released. So if your prolactin level is high, in some women, it can present with escape of breast milk from the breast. The only time it's allowed for breast milk to escape from a woman's breast, it's during pregnancy and if the woman is newly delivered of a baby. Once you have escape of breast milk from your breast, which is called galactorrhea, there's a problem. We need to figure it out, we need to check, and we need to correct the problem. So my teaching this afternoon, it's based on 5 things we can do naturally to enable us to maintain the normal level of prolactin. Now, thankfully, if your prolactin level is the reason why you're not able to achieve pregnancy, thankfully, there are some drugs we can give you to correct your prolactin level so that it will be within the normal range. If you have ever been sent to the lab to run a blood work for your prolactin, I want you to pay attention to your result. You will have 2 numbers in the bracket. That's the normal range. So I'm going to use tentative example because different labs will have different results. So assuming you have the normal range to be 9 to 20 and your result shows you have 15. 15 is contained between 9 and 20. So 15 is normal. Assuming within the 9 and 20, your result says it's 40. 40 is higher than 20. So by default, you have high prolactin level. So you will be a candidate that will receive prolactin drug that will help the prolactin level to come down. Now, if the only problem you have preventing you from becoming pregnant is your high prolactin level, when we correct the prolactin level with specific drugs, you will become pregnant. So the first thing to be conversant with when we are trying to look at correcting the prolactin level naturally is to do what? To eat healthy. Eat healthy. Healthy meals will help you to normalize all the levels of all the important hormones in your body. So what do I mean by eating healthy? Increase your fruits, increase your vegetables, drink a lot of water, mind your calories, mind your carbohydrate intake, take the right quantity of things you need. If you do this religiously and conscientiously, you are working towards reducing and normalizing your natural level of your prolactin. Now, also work on your stress level. So your diet and your stress level can lead to increase in your prolactin level, which can by default affect your ovulation. So number 1 point, it's your diet and your stress level. Number 2, stop high intensive workout and activities that will overwhelm your body. You see, in as much as we want you to exercise, be mindful, some women go overboard. So when you're exercising, make sure your exercise is what? Low intensity or moderately intense exercise. Don't go overboard. When you go overboard, excessive exercise can actually be a factor that can stop you from becoming pregnant. So don't go overboard. You can go for walk, you can run, you can lift weight, but be careful. When you go overboard and when you confuse your body, you will likely have an increase in your prolactin level. So watch your workout routine. Now, the next thing, it's the type of clothing you wear. The body of a woman, unfortunately, is very sensitive. When you wear tight-fitting clothing, when you don't give your breast tissues enough room to feel comfortable, to move around, the more you put pressure, the more you wear tight-fitting clothing in your body, especially if you don't have a very good, healthy BMI. The more you compress your breast, the more you put a lot of tension on your breast based on the type of clothing you wear, the more you're putting the breast tissues to pressure that might likely trigger high level of your prolactin. So be mindful of the type of clothes you wear. You can see I haven't given you any drugs, right? So anytime you're wearing any clothes, especially your bra, make sure your bra is the right size. Make sure it's not uncomfortable. Make sure there is no friction. When you do this, you have a possibility of normalizing your hormone, the prolactin hormone. Now, the next point I want us to pay attention is what? Clothes that will also increase stimulation of the nipples. So you see your nipples, actually the original design and intention for God for your nipple is to breastfeed your baby. Now, in case of sexual intercourse and activities, your partner can play with your breast and do a couple of things. Now, that's momentarily. But if you have a situation where you have an exposure to maybe activities or clothing that will increase constantly the stimulation of the nipples, the body will be triggered. Our body is very sensitive. When your body is triggered, a couple of different hormones will start playing tricks. Prolactin is produced in a special place in the brain. When this happens, it's going to go give a loop feedback to the brain, and the body will start reacting by producing a lot of prolactin. Now, the last point, which is the 5th point, before I take my question, you also have to make sure you have adequate quantity of vitamin B6 and your vitamin E. Thankfully, for this, you don't need to go and single out these vitamins. What you need is already provided you in your prenatal multivitamin. So long as you have your prenatal multivitamin, make sure you take them religiously. 3 months before the period you're anticipating you will become pregnant, and 3 months into your pregnancy. If you can do this conscientiously, you are naturally improving the possibility of having a normalized prolactin level. So let's quickly recap before I start taking questions. Number 1, eat healthy. Increase your fruits, vegetable intake. Make sure you have adequate quantity of all components of food. Avoid stress. Stop high intensity workout and activities that will overwhelm your body. Make sure that the clothes you're wearing is very comfortable. Make sure your breast is freely moving and not in an uncomfortable position. Make sure the activities you indulge in, like if you're exercising, there are some sports bra you need to wear. When you put a lot of pressure and a lot of tension on the nipples, you are tentatively, indirectly increasing the trigger mechanism that will go to your brain and start producing prolactin in high quantity. And finally, Make sure you take your prenatal multivitamin. We are focusing on vitamin B6 and vitamin E. They are contained in your prenatal multivitamin, exactly the quantity you need them. Okay, so thank you so much for coming. Now, I'm going to allow you to ask your questions. And in attendance this afternoon is also my partner, Dr. Nietzsche. So Dr. Nietzsche will also be attending to questions. But right now, I'm going to give you an opportunity to ask me questions, and I'll give you feedbacks. So please go ahead and ask your questions. Remember, today we are looking at the 5 natural methods of reducing or maintaining your prolactin level, okay? So that's the topic for this afternoon's break time discussion. So please go ahead and ask your questions. Ask your questions. If you have any question, please go ahead and ask, and I'll provide you feedbacks. Everybody is free to ask. If you don't understand the role of prolactin, if you don't understand how it's going to affect your body, then this is an opportunity. If you've been told your prolactin level is high, in some situations, we can give you some drugs. You can go back, you can take them momentarily, and you will be fine. Then suddenly it will come back again. There are different ways we can approach that. If the drug we gave you is not working the way we want it to work, please piggyback to your provider. We can change the dose, or we can give you a different drug. There are different drugs we can use in managing prolactin level. Okay? So please go ahead and ask your questions in real time, and I'll give you feedbacks. If you have any question, please go ahead and ask, and I'll give you feedbacks. Do we have any questions? Okay. Hello, doc. It's irregular period caused by high prolactin. Very technical question. So here's the deal. Directly, prolactin level and your period are not connected. But guess what? Remember that when your prolactin level is out of range, it's actually one of the presentations of hormone imbalance. So it might not directly lead to irregular period. But when your prolactin level is affecting the function of all the other important hormones, indirectly it's going to affect your period. So do you understand my logic? Prolactin level directly, whether high or low, might not lead to irregularity in your cycle. But when your prolactin level affects the function of estrogen, affects the function of progesterone, affects the function of FSH and LH, the normal way that your period is supposed to function will indirectly be affected. Now, what leads to your period? When the cover of your womb, which is called the endometrium, hold on, let me show you. That's a very, very good question. So let me demonstrate. It's always good to demonstrate. So you see, this is the cover of your womb, right? It's called the endometrium. So what leads to bleeding? In a woman's whole menstrual cycle, the overall aim of this body is to have a baby. The way God made women to have their babies any which way. So once in a month, you release egg from these ovaries. The egg will wait in the ampulla, in the tube. The sperm will come in and fertilize the egg. While all these things were happening through the process of fertilization, the cover of your womb is getting ready to receive the baby. Now, if fertilization happens, it will go back and start developing in the womb. When that happens, you will not bleed. Your bleeding will cease. Now, when there is no fertilization, when there is no baby, the womb will start weeping. So when you're bleeding, your womb is actually weeping. Your womb is mourning the fact that in this particular month, there was no baby to nurture and receive. So that's what happens when you bleed. Bleeding is the disintegration of the upper cover of your womb, which is an evidence that there was failure of pregnancy to happen. Now, here's the deal. In some women, they might not bleed, but they have produced their eggs. They can become pregnant. So bleeding on its own, it's not the only key factor you have to look out for. Some women might have irregular period, especially if you're newly delivered of a baby. You might not bleed, but you've ovulated, and you can become pregnant. So the key word in becoming pregnant is actually the egg and the sperm. So some women can still go ahead and the cover of the womb will be preparing and you'll be shutting off. Now, if your tubes are blocked, some women will be wondering, can you still bleed? Yes, your bleeding is independent of what happens in the tube. Can you still ovulate? Yes, because when you release your egg, the eggs will come in. The only problem is that it might not go back to implant. But the hormones that is responsible for keeping the cover of your womb, going, which is progesterone and your estrogen, will still be okay. So I would say indirectly, abnormal prolactin level can affect the totality of your cycle. Okay? That's a good question. So do we have any other question, please? Feel free to ask your question. Remember to subscribe. Remember to comment. Remember to ask all your questions. If you're in our Facebook, remember to join our group. Remember to be in our page. If you're my personal friend in Facebook, you can also participate. If you're in Instagram, you can participate. But please make good use of this opportunity. There are so many helpful videos in this channel. So if you missed any particular one, you can always piggyback and review and learn from them. Everything we do in our group is to empower you, to give you the knowledge you need so you can take the bold steps you need to take so you can become. Okay, so if you have any other question, please go ahead and ask, and I'll provide you feedbacks. So admin, you can also feel free to ask your questions. Okay? Dr. Ndiche, you can also ask your questions if you have any. I have a few more minutes, then I will close the clinic. Remember, every day you show up in our groups, Nospirations, Global Health Solutions, there is always something to learn. Later this afternoon, I think in the next 45 minutes, Dr. Ndiche is also going to teach you guys on our platform. So show up, learn, improve, act, and do the right things. If you notice, I love praying, I love playing, and I love practicing. This is what we do in this group. We run our triple P. We pray, we play, and we practice. This is the secret of all the testimonies you see in our group. We are very prayerful people. We believe in love making every 48 hours. Then we also believe in seeking help. The earlier we seek help, the better. Discharge of milk, like substance from a woman who is not breastfeeding, what's the cause? Now, like I mentioned, high prolactin level is one of the likely causes of galactorrhea. So when you have escape of breast milk from your breast, it's called galactorrhea. So in some women, not all women, some women will have high prolactin level and they're not having galactorrhea. But most women that have high prolactin level will have galactorrhea. So that might be a presentation that your prolactin level is high. However, there are a couple of other things that can also lead to galactorrhea, which might not be related to prolactin level. Some women can have a growth in the place that prolactin is produced, which is called prolactinoma. So prolactinoma is a benign tumor in the brain part where prolactin is produced. Benign means it's not a cancer. So when you have a growth in that particular part of the brain, it will trigger high production of prolactin. Very good question. I love that. So discharge of breast milk when you're not breastfeeding, when you're not pregnant, is called galactorrhea. That's one of the presentations of high prolactin. But it's not all the discharge that means your prolactin level is high. There are other things that can cause discharge of breast milk from your breast when you're not pregnant. There are also some drugs that can lead to this. So we need to take you to a gynecologist and confirm exactly the type of problem you have. Okay, hello doc. What's the effect of too much or too less prolactin on males? This is a very, very smart question, actually coming from a male. So here's the deal. There are different ranges expected of men. So the whole hormones we have in women, we can find in men. The whole hormones we have in men, we can find in women. So men also have estrogen. Men have progesterone. Men have prolactin. Men have pretty much all the hormones. They share it together. But here's the deal. The level of the hormone in a male is supposed to be within a particular range. Male-dominated hormones are called the androgens. Top on the list is testosterone. Now, if a man has prolactin issues, that means the level of prolactin expected in a man is very high, then that's hormonal issue there. So it can also lead to factor that might affect the man's probability of becoming a father. So high or low level of prolactin in a man outside the given range that is expected of that man can be a factor in male infertility. Now, there are also some manifestations in men which can lead us to think that this man might be having some hormonal issues. There are some men that will start developing breast, which is called gynecomastia. A man ordinarily is not supposed to have a breast like women. Now, in men that have infertility, if we notice that they suddenly started developing gynecomastia, it's possible they are exposed to estrogenic products. So we need to monitor their level. We need to work on them to bring down the level of estrogen low. When a man has a higher level of estrogen, the likelihood the man is not going to be able to perform its role as a father is high. The same thing is applicable to women. When a woman has a higher level of androgens, which can happen in a condition we call polycystic ovarian syndrome. When a woman has higher level of testosterone and other androgens, the woman will start exhibiting characteristics as if he's a man. So that's why you see men that have hirsutism, increase in facial hairs, and hair distribution as if they are males. When we discover this, we can work towards correcting that, because when you have more male-dominated hormones in lieu of more female-dominated hormones, it's going to likely lead to infertility. Okay, so the key word is we all share the same hormones, but there are expected ranges for males and females. Once you flip outside the range, that's where problems begin. Very good question. Can high prolactin cause infertility? 100%. That's one of the easiest and simpler pathway of treating infertility. So when your prolactin level is high, it will affect the function of other important hormones, especially your FSH and your LH. So you will likely not ovulate. So high prolactin level, which is hyperprolactinemia, is a known factor that can lead to female infertility. So we need to discover that. We need to give you specific drugs that can address that prolactin level on its own. But here's the problem. We might fix your prolactin issue, but you might have blood tubes. We might fix your prolactin issues, your blood tubes, but you might have hormone imbalance of other hormones. We might fix both of them. The problem might be coming from your mouth. Or you might have adhesion. So there are so many factors that can lead to female infertility. And there are so many factors that can lead to male infertility. Your duty is to do your best to live healthy, adopt a very healthy lifestyle. Make sure you watch your body weight. Make sure you eat properly. Avoid stress. Then please make love. Unfortunately, we are not making love enough. Majority of us are just interested in having babies, but we don't follow the pathways. The fastest way to become pregnant and become a mother in our group is what? PPP. We pray, we play 48 hourly, then we practice. Practice means seeking help. So if you're in our group, you can get help, you can subscribe, you can be set up with a provider on ground who will find what the problem is, then they can give you the help you need. Okay? All right, guys. Very interesting questions I got from the audience. So if today is the first day of coming to our clinic in YouTube, thank you so much. Please, before we leave, make sure you subscribe, check other previous videos, learn, practice, and keep practicing. Keep practicing. If you are not pregnant in July, it's going to happen in August. If it's not August, it's going to happen in September. The most important thing is that it's going to happen. So I'm encouraging you to keep on doing your best, keep on doing the right things, keep on meeting with your partner, keep on seeking help. When you don't understand, seek help. Whoever seeks help will get help. But when you don't seek help and you're believing that God is going to come down, unfortunately, God is not just only interested in you. God has given you a sound mind to get the knowledge you need so you can become. Okay, so do we have any other question? If we don't have any other question, then we are going to go for the day. Thank you so much. Tomorrow it's Friday. Fridays, we normally run our 4 days Fridays. So we're going to look for a good topic to discuss, and we'll see what we can do about it. So I'll see you guys in Dr. Ndiche's clinic, and thank you for coming. Please, if you have any question, I still have a few more minutes. If you're attending and you have any question, please feel free to ask. Okay? Feel free to ask. This is a very important topic. Very, very important topic. If you have high prolactin problems, you can get help. The best help you can get is to seek help. When you seek the proper help, you will get help. Okay? So thank you for coming this afternoon. I appreciate you guys. And in the absence of any question, I'm going to take my leave. Okay? All right. Thank you. I'll see you guys tomorrow. Bye-bye for now.